Dr. Suresh Kumar, what is the status right now? Are you getting COVID-19 cases? What sort of patients are coming in? You're looking at clearly what's unfolding in China. How prepared are Delhi hospitals, sir?
Thank you, ma'am. Right now, we don't have any indoor patients. For last 3 weeks, there are 0 admissions in the COVID category. But we do some patients where there are symptoms like flu, and we are testing them. A majority of these patients are negative for COVID. And we have seen that the new sub-variant, BF7, is seen in many countries. So we are fully prepared this time that if we have the patient with the cough, breathlessness, fever and flu-like symptoms, it's a mandatory testing is available around the clock. And at the same time, if any patient is positive by RT-PCR, we are submitting all the sample, 100% sample for genome sequencing. As Loknayak Hospital is also doing the gene sequencing, so we can detect the new variant at the early stage. And at the same time, we have ramped up all the indoor facilities, training of our healthcare professionals, and we have increased our ICU beds. Our all infrastructure is in place, and oxygen supply chain is already, we have augmented from 5 ton to 50 ton in our hospital. In Loknayak Hospital, we have sufficient surplus oxygen available for if any requirement comes up in the future.
Right, that's good to hear, sir, and we do hope that that will not be needed, but it's good to know that at least we are prepared this time. Sir, stay on with me because India Today exclusive details are coming in. Inside details of Centre's COVID meeting, sources have said mask will not be made mandatory. Central government will not be making the mask mandatory for the time being, but it is an advisory and citizens must ensure they follow all COVID appropriate behavior. But people will be asked to wear the masks. In between, of course, there will be locations where they will have to follow all these precautions, but it shouldn't actually come from the government. It should come from the citizen themselves as a responsibility. So that's the big news break that we are getting to you. I want to go back to Doctor on this. Dr. Suresh Kumar, because, you know, again, these are protocols that are needed. What are you looking at any difference when we see what's happening in China or other countries? If the viewer watching you right now, the ones who've not got a booster dose yet or have got all the vaccinations, you know, what are the precautions should they take care of? Should they get the booster dose? What are we looking at? How safe or unsafe? What are the symptoms to be followed? Do give us a message to the viewer watching you right now, sir.
That's very important because if you see the booster dose or precaution dose, it is only around 27% in the country right now. But we need to increase more booster dose because the population, particularly above the age of 60, and those who have associated illness like diabetes, hypertension, cancer patients, tuberculosis patients, they need to be vaccinated because the efficacy of this vaccine remains for 6 months. So after every 6 months, you need to have a booster dose or precaution dose. That is mandatory. At the same time, we must follow the COVID protocols, COVID guidelines, and mask is very important because if simply wear the mask, that protects us from this new variant. That is very important.
All right. Thank you so much, Dr. Suresh Kumar.